Greetings, viewer, and welcome to today's show. Today we are going to disseminate Violet Mbiti Foundation First Research. So here is to giving you background information on how we got here. So Violet Mbiti Foundation conducted a research at level 4 and 5 public health facilities, primarily focusing on supplies of medical drugs and vaccines. It is worthwhile to note that research plays a key role in shaping policies, and Violet Mbiti Foundation captures this in their work. When public health facilities have adequate supplies of drugs and vaccines, they will be able to deliver high-quality primary healthcare, which will contribute to achievement of sustainable development goals. Last month, Violet Mbiti Foundation was privileged to train budget champions from Machakos County on the program-based budget for the financial year 2024-2025, with a focus on the health sector to respond to a public participation called by the County Assembly of Machakos. We thank Uraia Trust and Danida for their support through the SPARK project. While the budget champions were analyzing the recurrent expenditure for medical drugs, vaccines, HIV, and AIDS at level 4 and 5 public health facilities for the last 3 years, namely financial year 2022-2023, financial year 2023-2024, and financial year 2024-2025, they realized a drastic decline in funding allocation for level 4 and 5 public health facilities for the financial year 2024-2025. I am going to share the findings with you in a bit. And as a result of the findings, we were able now to disseminate the data to policymakers, and I'm going to share that a little bit later. So let's get down so that you may get to hear or get to know about the findings of the research. Okay. So let me screen share so that we may be able now to embark on the research. I trust you can now see the screen carefully. So let me zoom in so that it will be easier for you to see. So the research was conducted by Violet Mbiti Foundation, and you can see the logos of Uraia who funded us, who funded even this particular activity that we had in Machakos County. And we also have a Violet Mbiti Foundation digital platform called Budget Cafe Discussions. So the title is an analysis of health sector funding for drugs and vaccines in Machakos County, level 4 and 5 facilities. So the abstract is the program-based budget is a critical document that outlines financial allocations to various programs and sub-programs within a fiscal year. This study examines the budget allocations for medical supplies, including drugs, vaccines, and treatments for TB, HIV, and AIDS at level 4 and 5 public health facilities in Machakos County for the financial years 2022, 2023, 2023, 2024, and 2024, 2025. The analysis reveals significant fluctuations in budget allocations without clear justification, posing challenges for oversight and public understanding. So what was our context? As of May 29, 2024, all 47 counties in Kenya owe the Kenya Medical Supplies Agency a total of 2.88 billion, with Machakos County owing 122 million. This debt has led to a shortage of essential life-saving drugs in at least 27 counties, including Machakos. So the data was gotten from KEMSA CEO during an exclusive interview on Daily Nation. Our research methodology. This study adapted desktop research to analyze program-based budget for financial years 2022-2023, 2023-2024, and 2024-2025, focusing on recurrent expenditure estimates for health sector allocation. The target facilities include Machakos Level 5, Kangundo Level 4, Matuu Level 4, Kathiani Level 4, Mwala Level 4, Kimiti Level 4, Masinga Level 4, Athi River Level 4, Mutituni Level 4, Ndidhini Level 4, and Kalama Level 4. Research findings. On average, Machakos County has allocated 34.51% to the health sector in the 3 years between financial years 2022-2023, 2023-2024, and 2024-2025. However, the budget for medical supplies at various facilities showed significant increases in the financial year 2023-2024, followed by declines in the financial year 2024-2025, with no clear justification provided. So the graph below shows the Machakos County health sector allocation. So you can see that in the financial year 2022-2023, the health sector allocation as compared to the total budget for that financial year was 35.95%. In the financial year 2023-2024, it was at 33.45%. And in the financial year 2024-2025, it was at 34.15%. All right. So Machakos Level 5 allocation for medical drugs, vaccines, TB, and HIV/AIDS. So significant increase of 8,795,798 Kenya shillings towards supplies of medical drugs, vaccines, TB, HIV/AIDS when comparing to the financial year 2022-2023 and financial year 2023-2024 budget allocation. So as you can see, this first paragraph, this first table, not table, but graph, you can see that in the financial year 2022-2023, 43,833,790 was allocated towards medical drugs, vaccines, TB, HIV/AIDS. The following year, 2023-2024, 52,629,588 was allocated towards medical drugs, vaccines, TB, HIV, and AIDS. This therefore means that there was an increase of 8.7 million towards that. But when you look at the financial year 2024-2025, you can see a drastic decline in the budget allocation towards medical drugs, vaccines, TB, HIV/AIDS at Machakos Level 5 facility. The decline totals to approximately 2.39 million. When you go further now, starting to analyze Level 4 facilities, you can see that in the financial year 2022-2023, Kangundo Level 4 was allocated 8.6 million, approximately, towards supplies of medical drugs, vaccines, TB, HIV, and AIDS. And in the financial year 2023-2024, the number jumped to 20 million. And in the financial year 2024, it's declined by 18 million. So you can see that the difference here between the financial year 2022-2023 and 2023-2024, the increase was of about 11.3 million. And in the financial year 2024, it dropped by a budget of 2 million with no justification provided. At Matuu Level 4 facility, If you look at the graph, you can see that 8.5 million was allocated for Matu level 4 for medical drugs, vaccines, TB, HIV, and AIDS. But in the financial year 2023-2024, you can see the number jumped to 20 million, which is about 11.47 million. But in the financial year 2024-2025, the number jumped to the allocation declined by 2 million. And you wonder why. Same case applies to Kadiani level 4, where you can see that in the financial year 2022-2023, the budget allocation was at 5.5 million, while in financial year 2023-2024, it was allocated 20 million. This was an increase of 14.4 million. But in the financial year 2024-2025, the budget declined by 2 million, and the number amounted to 18 million. So you can see so far where we've reached in the financial year 2024-2025, there was decline in funding allocation for medical drugs, vaccines, TB, HIV, AIDS. So let's go to the other facility, Mwala level 4 facilities. So you can see that in the financial year 2022-2023, it was allocated 2.8 million. While in the financial year 2023-2024, the number jumped to 20 million, which showed a significant increase of 17.1 million towards supplies of medical drugs and vaccines, TB, HIV, and AIDS. Now in the financial year 2024-2025, the funding allocation dropped to 13 million, which represents a 7 million shillings cut. At Kimiti level 4 facility, in the financial year 2022-2023, you can see that the facility was allocated 1.1 million. But in the financial year 2023-2024, the number jumped to 15 million, posing a significant increase of 13.8 million. But in the financial year 2024-2025, the budget allocation dropped by 7 million at Kimiti level 4 public health facility. At Masinga level 4 facility, in the financial year 2022-2023, the facility was allocated approximately 1.1 million. And the numbers jumped in the financial year 2023-2024, where it was allocated 20 million towards medical drugs, vaccines, TB, HIV, AIDS, which shows a significant increase of 18.8 million. But in the financial year 2024-2025, the budget dropped by 2 million. At the River Level 4 facility, you can see that in the financial year 2022-2023, they were allocated approximately 1.1 million towards medical drugs, vaccines, TB, HIV, and AIDS. And in the financial year 2023-2024, then the budget allocation increased by 15 million, which represents a 13.8 million increase towards supplies. But in the financial year 2024-2025, the funding allocation to at River Level 4 facilities was 18 million, posing a decline of 7 million. At Mutituni Level 4 facility, in the financial year 2022-2023, the budget allocation was 1.1 million approximately. In the financial year 2023-2024, the budget allocation increased significantly to 15 million, which poses a significant increase of 13.849044 million towards supplies of medical drugs. But in the financial year 2024-2025, the budget allocation dropped by 7 million. At Ndidhini Level 4 facility, in the financial year 2022-2023, the budget was allocated 1.2 million. And in the financial year 2023-2024, it increased by 15. It was allocated 15 million, showing a significant increase of 13.7 million towards supplies of medical drugs, vaccines, TB, HIV, AIDS. But in the financial year 2024-2025, the budget was cut by 5 million shillings, so that now the final allocation stands at 10 million shillings. At Kalama Level 4 facility, in the financial year 2022-2023, it was allocated 1.2 million. And in the financial year 2023-2024, it was allocated 15 million, showing a significant increase of 13.7 million approximately. While in the financial year 2024-2025, the funding allocation dropped by 2 million shilling at Kalama Level 4 facility for medical drugs, vaccines, TB, HIV, and AIDS. So, after our presentation, what we did is go and present the findings to policymakers. So we wrote a request to the County Assembly of Machakos, specifically the Budget Appropriation Committee, and they responded to our request and invited us to go and present to them the findings. So I'd like to show you even photos of our meeting with them. Okay, so let me share screen. There is the Windows, and then just want to go to downloads. You can see from the video, we went and met the Budget Appropriation Committee, where we presented the findings. And I'd also like to show you another photo. So that you can see the invitation letter that we received from the County Assembly, so that we can go and present to them. So you can see a letter from Republic of Kenya, County Government of Machakos, County Assembly of Machakos, where now we got the official invite to meet them on the 11th of June, 2024 at the boardroom. All right. So when we were there, we shared with them that prior to our coming there, we had requested the Office of the County Secretary, specifically Chief Officer Medical Services, to share with us why there was a decline in the budget allocation towards supplies of medical drugs and vaccines. So when we went to the Office of the County Secretary, because in Machakos County, if you want to maybe see a chief officer or any other department, you have to get permission from the Office of the County Secretary. Unfortunately, when we submitted our letter, we didn't receive a response. So when we shared our findings to the Budget Appropriation Committee, they stated that they are going to follow up with the Office of the County Secretary, notably the Chief Officer Medical Services, so that we can get to know whether the decline in funding allocation was due to reduction of visitors to the public health facilities. So we want to thank the Budget Appropriation Committee for the opportunity to share the research findings with them. After the presentation, they stated they will share the recommendations made with the Department of Finance, who they were set to meet prior to the passing of the approved budget. So I would like to show you the recommendations that we made. So here are the recommendations. So to address the issues identified in the study, the following recommendations are proposed. Number one, Department of Finance and Department of Health at the executive level, and Budget and Appropriations Committee, as well as Health Committee at County Assembly, should establish accessible channels for citizens to provide feedback on healthcare services and budgetary needs, ensuring their voices are heard and considered in budget allocations. There are significant increase towards budget allocation between financial year 2022-2023 and 2023-2024, as well as significant decreases in budget allocation between the financial year 2023-2024 and 2024-2025. It is prudent for the county government to provide justification on decrease and increase of budget allocation towards supplies of medical drugs, vaccines, TB, and HIV/AIDS. So that was the research that we carried out, and we trust that the county government will even look at the supplementary budgets and see how they can utilize the budget to ensure that that there is adequate supplies at the facilities. So I want to say thank you for joining us today, even as we presented the findings. Asante, and you can share the video with your networks. And also, I'd also like to mention that I shared the findings of the research with my network across Africa, and I'm happy that the Honorable Member of Parliament, Honorable Gila from Zimbabwe, utilized the the findings of the research to inform a meeting that they were having the following day with the Minister of Health, Zimbabwe. So thank you, Honorable Decent, for utilizing our research so as to improve service delivery in your county. I trust that in your constituency, I trust that this the findings are going to influence or improve service delivery in Machakos County soon. So thank you, and I wish you an enjoyable day.